And we are live. Welcome to Healthcare Thought Leadership LinkedIn Live Show's first webinar. This is a webinar series that allows you to go deeper with our channel partners, the companies that we've highlighted on our LinkedIn Live Show. If you're joining us on the webinar, please post in the comments. Let us know you're here. Let us know what questions you have about today's topic. And today's topic we're talking about, and we're going to go deeper on this platform called Traksio. Traksio is a platform to help with risk management, project management, consulting, a lot of different aspects, and we're gonna get to see a demo here in just a moment. You know these people if you joined us for the Healthcare Thought Leadership LinkedIn Live Show. We have Jonathan Wirth with us from JW Turtlehawk Consulting and his team. They're all partners, Julie Sadovich and Jane Norman. Say hello to everybody, guys.
Hi, guys.
Thanks for having us.
We're so glad to hear. So we're going to start a video that really goes deep for the next several minutes about the platform. And then afterwards, hold your questions and then post them in the comments. And then we're going to have a discussion around that. Please let us know you're watching. Let us know what questions you have. I'm so excited to be sharing this with my network and sharing it through this platform as well as my LinkedIn audience. My name is Marion Spears-Carr, and I run a company called Inflow Executives and Executive Search and Leadership Solutions Company. So let's get started. Here we go.
Welcome, and thank you for letting us share Traksio with you. Traksio is a second-generation platform from the original Amy Hub, a software for improvement projects only. Traksio supports risk, project, and quality management in an easy-to-use manner, regardless of expertise. This is the Traksio homepage. From here, it's easy to choose your path. The go-to provides navigation to all Traksio functions. The risk management, project management, and improvement project boxes show the Traksio operational definitions. The blue navigation ribbon is always visible for navigation within all Traksio functions. As you move through Traksio, you will see our screens are set up and function in a similar manner for ease of use. Select training. To access step-by-step instructions for all Traksio functions. Let us get started with risk management and enterprise risk management. The ERM list screen allows users to add a new ERM assessment, view a report for an existing ERM assessment, export the list to Excel, or select an existing ERM assessment. As we go through Traksio, you will see the list screen works the same for all Traksio functions. Please click on the ERM demo file. The ERM input screens default to the Identify section on the navigation ribbon. Each function in Traksio has a navigation ribbon to guide users through the function. Accessing tools from the navigation ribbon will link the tool or file to the assessment. Traksio allows access control for each function. Traksio defaults to public, which means the file may be accessed by all users in the organization. If desired, access can be limited by clicking on public, which then changes to private. Now, only the originator has access. By clicking on access, the originator may grant permission to specific users. Select the user, then select Save. Please change back to public. The ERM Identify screen allows users to identify risk, assign a risk type, assess the risk using severity, occurrence, and detection difficulty. The risk priority is calculated, and risk response is determined. Failure mode effect analysis can be linked to the ERM assessment here. If FMEA is highlighted, one has been created. We will come back to FMEA in a minute. Once the identify is completed, the next step is to determine potential solutions. Notice on the left-hand side, the identified risk and risk response are listed from the previous step. Users can enter one or more potential solutions, identify which risk the potential solution addresses, assess potential solutions using cost, impact, and likelihood of success. The solution priority is calculated, and users can enter approval information and notes. Select ERM status to view the reports list screen. Remember, this is a report, so changes and edits cannot be completed here. You would need to go back to the ERM assessment. On this screen, users can go back to the ERM assessment, open existing reports, delete reports, and add a new report. Please select Add a New Report. The report shows all the information from the Identify and Potential Solutions screens. Users can export to Excel, go back to the reports list, go back to the ERM assessment, finalize or unfinalize the report. This completes Enterprise Risk Management. Please go to Risk Assessment. As you can see, the list page is the same as we have seen. Please open the Risk Assessment demo file. The function navigation ribbon is the same as well. Remember, tools and files accessed here will be linked to the risk assessment. The risk assessment identify screen allows users to identify risk, assign a risk type, assess the risk, and determine risk response just like the ERM. Note the two key differences from the ERM page. The risk type is limited to risk, threat, and opportunity. And here you can link to an FMEA or an RCA, root cause analysis. We will come back to this in a minute. The next step is potential solutions. As you can see, the identified risks and risk response are listed from the previous page. Potential solutions can be identified and assessed in the same manner as done in the ERM. Select Risk Assessment Report to view the reports list, and then select a new report or an existing report to view the report. The reports in Traksio have the same functions. Please go back to Risk Assessment. From the Identify screen, users can complete a failure mode effect analysis and a root cause analysis. This will be linked to the risk assessment. Please select FMEA. On this screen, users can enter one or more risks, complete the failure mode, failure effect, severity, potential causes, occurrence, process controls, and detection difficulty. Users can identify potential solutions and assess using cost, impact, and likelihood of success. Note the legend above. Select Actions to assign a responsible person, document results, and add an estimated and actual completion date. Select FMEA Report to view the reports list, and then select a new report or an existing report to view the report. Please go back to failure modes and risk assessment. Select RCA. The RCA event screen will be displayed. Here you can identify when and where the event occurred and who was involved. Using the timeline function, users can create a timeline of the event, including the date, time, and who was involved with each item. Select Data and Information. This screen allows users to analyze the event from a systems perspective using the factors on the left. These factors are compatible with the Joint Commission RCA template. The user describes the contributions of the factors to the event. The root cause contributors can be identified and selected by selecting the box in front of the factors. Short-term corrective actions and long-term preventive solutions can be identified with an implementation date and approval information. Select reports in the ribbon to view the report list, then select a new report or an existing report to view the report. Please go back to root cause analysis, then risk assessment. Traksio packages the IHI RCA2 requirements through the risk assessment function, the RCA, and the tools available. Please go to homepage. Using the Go To on the homepage or the blue navigation ribbon, users can access and create FMEAs and RCAs without creating an ERM assessment or a risk assessment. This completes risk management. Please go to custom tracking. As you can see, the list screen functions as we have seen. Please select the custom tracking demo. The Traksio custom tracking function supports risk management, project management, and quality management. Custom tracking is designed for flexibility by the organization for any tracking needs. Users can control access to tracking forms as we've seen before. The Traksio custom tracking function allows users to import your existing tracking spreadsheets from Excel, select import, then your file. Users can create a tracking form by entering the format, or users can select a template tracking form using the drop-down, then the load template. Users can edit or change these templates. Supporting documentation files can be attached to the tracking file by selecting Files, then dropping the file into the box. Users must click on Save for data or information to be saved. Please go to the home page. Now we are going to project management.
Project management is used to implement or spread changes. Depending on the complexity of the implementation, traditionally it requires a certified project manager. But Traksio has simplified this process significantly. Let's go to project management and take a look. Just like risk management, we have the list, which allows us to add or open an existing project. One difference here is that you can go directly to the 3 reports without opening the project: the Gantt, task status report, and corrective action ticket status report. Let's open the demo to see the details behind the project management Traksio reports. Just like risk management, the navigation ribbon guides you through the project management steps to plan, execute, collaborate, report, and supplement with files and tools and control access if needed. To plan a project in Traksio only requires 2 steps: identify the basics and define the specific tasks. We start with the identify screen to provide basic information. If a business case or feasibility study has been completed, check the box and upload these or other relevant files as needed. Then just add the overall deliverables and resources for the project. Now let's go to tasks. Here, each identified task is added with planned corresponding start and end dates and responsibility for the execution of each task. Milestones can be added as well. Let's go to the Gantt chart to see how this detail creates the Gantt chart. On the Gantt chart, the plan for each task is represented by the yellow line. In this example, the Gantt provides status for tasks with the blue line. One task shows dark blue and light blue. Hovering over the blue line shows the task is 20% complete. The milestone is a diamond. Slide the divider to view the specifics. Now, let's see how we update status to create these blue lines by going to the ribbon and clicking on Status Updates. During execution, status updates are reported on this screen. You will note all tasks are listed, but by using the search, tasks related to Mary can be found quickly. Now click on the desired status update button. This allows input of the actual start date of the task and routine updates of completion percentage and notes. Once this information is entered, Traksio tracks the details, including the name and date of the person who provided the update. To see the status of all updates, go back to the ribbon in Reports and open the Task Status Report. This report allows you to see the progress and notes for every task. You can export this report to Excel to edit or distribute outside of Traksio. Unfortunately, during execution, all implementations do not go without issues. When this happens, users will access the Corrective Actions button in Execute to submit tickets which need action taken. Just like other list screens in Traksio, you can add a new ticket, review the existing list, or access a specific ticket. In this screen, you'll see a list of all tickets, including one which was not submitted. Let's look at the ticket which was not submitted. When a new ticket is added, Traksio assigns a ticket number and opens a screen for the user to share what happens as well as any workarounds and suggestions they have. This information helps the assigned corrective action manager troubleshoot more effectively. Ticket administration is locked, and only accessible users who have been designated as corrective action managers in their profile by an administrator can edit this section. Once a ticket has been submitted, the overall CAT manager changes the status and assigns the ticket and adds any notes. The assigned CAT manager uses a screen too and adds notes and relevant information, including estimated and actual resolution dates when applicable. Now let's go back to the CAT list. Status updates are reflected on the corrective action ticket list. To view notes and solution descriptions, user can click on the corrective action status report. The transparency of corrective action details helps to prevent unnecessary calls and inquiries due to lack of information concerning specific issues of interest. During a project, routine team meetings are conducted to collaborate and work together on a project. Traksio's team meetings provide documentation and access to a list of team meeting agendas and notes that the team has had. We will talk more about this feature and tools in the Improvement Project module. This concludes the project management demonstration. Now let's use the blue ribbon to open an improvement project. In the improvement project list, the main difference is only one report, the status report. Let's go to the demo and see how this module has been designed. Again, the navigation ribbon defines the flow we will use to define, execute, collaborate, and report the improvement project. This module will also demonstrate the use of tools. Let's start with identify. General information about the location and team is added here. To identify what we're trying to accomplish, users list issues the improvement project is expected to address. Now let's move to the measures, which will define how we will know our changes have impacted these issues. Adding a measure is easy with a drop-down directional goal feature. For each measure, Traksio guides the team to provide the measurement type, how the measurement data will be collected, and the baseline. The most important goal the team wants to achieve should be the outcome measure. Now let's go to potential solutions. Here we are reminded of the issues we wanted to address. The team lists the changes which should solve these issues. To ensure all issues are addressed, use the drop-down next to each solution to click on the issues which the team predicts will be impacted by each change. The PDSA cycle uses a scientific method to test the change and verify it impacts our issues positively. To create the PDSAs for this project, click on Develop PDSA Cycles. On this screen, we have the option to run each solution as a PDSA or group changes into one manageable PDSA cycle. Here, each PDSA is named and numbered. Using the dropdown, all solutions which we included in the PDSA are checked. Traksio will use this information to move solutions to the plan of each cycle in the charter. By clicking on the Create PDSA Cycles and Charter button, the charter and PDSA cycles are ready for the team. Since we've created the charter already, please click on the charter in the ribbon. The charter uses the information from Define to align the team towards completing the improvement project quickly. Notice the final results are blank, ready to be completed once the changes are validated using the PDSA cycles. Each cycle has been put in order on the charter, and the solutions, including the bundled solutions, are listed in the corresponding cycle plan. Now the team can determine the start date for each PDSA, the questions and predictions. Since the changes listed are already in plan, the team just needs to add the test plan details. Once a test cycle is completed, the team will determine what they will do next and act. This drop-down allows the team to abandon a change that didn't work, retest if major changes are needed, or implement. Let's select Implement. Notice the implement cycle is moved under the original so the team can quickly document what happened when they expand the test and finalize it. Now click on the status report. Notice there's a final report on the list. This report shows completion of all cycles. Please go back to the project. Just as project management has team meetings, this function is also used for improvement projects. Click on Team Meetings in the navigation ribbon. Open the latest meeting. Notice the assignments. All users with assignments can access their assignments in My Tasks above their name. Click on My Tasks. This gives the assignee a to-do list from the meetings, even if they didn't attend, which can edit and they can go back to the meeting notes which created the assignment. Click on Go to Meeting on the assignment. This takes you back to the minutes where the assignment is made. Let's go back to the project and take a look at these tools. Since we've already demonstrated the file function, let's start with music. This is a charter evaluation tool which predicts the success of the project based on the team, the organization, and external support questions. The Save and Calculate Score button provides the operational definition of the score, which predicts the success of the team. As with all tools, more specifics are provided in the applicable training module. Results can be exported to the PDF format to share. Now let's go back to the project. Let's look at the Fishbone tool next. Click on Fishbones, which is part of this project. The fishbone or cause and effect diagram training gives you step-by-step instructions on how the fishbone is created by altering the outline on the left. Also notice the Save button. All tools must be saved. Automatic saving is only provided in risk management, project management, and improvement projects. Go back to the list and back to the project. Now let's look at the flow diagram function. Open the dental workflow for this project. Workflows are common changes which need documentation. The flow diagram in Traksio is easy to use. Flow diagram shapes can be opened, selected, and dragged onto the grid. Text and other easy-to-use functions are included and described in the training for this tool. Go back to the flow diagram list and back to the project. Our final demonstration will highlight analytic charts, which references and was developed with the Healthcare Data Guide author Lloyd Provost. Both analytic charts and flow diagrams can be used outside of a project by accessing the analytic charts in the blue ribbon or in the Go-To. But let's look at analytic charts for this improvement project. Only the chart files which are part of this improvement project are listed. Click on the Dental Schedule Project Charts. Even though this project has 6 measures, only one chart file is needed. This is because we use Excel with a different worksheet tab for each measure. Traksio analytic charts are a unique analytic feature to allow analysis of multiple types of data without the need for formulas. Using the dropdown, you can see the choices. Traksio uses the same web-based spreadsheet for charts as it used in custom tracking. Only this time, the data, when put in the correct format, will create Shewhart control charts for you, allow easy annotation and other features without requiring calculations or formulas. Time is spent learning from the data, and frustration is eliminated. The sheet names at the bottom of the spreadsheet represent all of the measures from this project. Lobby wait time is our first chart. Click Draw. Notice the annotations. Now click on Missed Appointments. Please click on Data Entry Format. This P chart for percent missed appointments has been put in this format to calculate the statistics needed to plot the charts. There are no formulas in the spreadsheet. The Notes column allows annotation and phasing of baseline or changes. Please close the format and draw the chart. Traksio has calculated the percentage and even identified a special cause from the first PDSA, indicating the change is an improvement from the baseline. Click on the special causes. Additional references from the Healthcare Data Guide, functions such as labeling or scale edits, are covered in the analytic chart training. Please close special causes. Spreadsheets can be exported for updates outside of Traksio, and the Excel sheet can be imported, which replaces what is there. Charts can be exported into PNG or SVG pictures as well. This concludes our Traksio demo. For pricing and more information about Traksio, please visit www.jwturtlehawk.com, the sole distributor for Traksio. And thank you for your time.
What a great demo, and such a detailed process that you guys have gone through. And even me, who doesn't know that much about that work other than the work that I've done from a executive search business, I could understand what you were sharing, both Julie and Jane. So thank you for that absolute great demo. One of the things that one of the questions I wanted to ask is that, and wanted us to talk about is, so this is a great platform that looks like it's easy to learn, easy to implement, could be used for so many different things. It's almost like a Swiss Army knife of risk management and decision making and all of those different things that you've built into it. But Jonathan, this is a question for you. Is it only available in the cloud, or if there's concerns about hosting it not on the cloud for concerns about getting cybersecurity issues, et cetera? How is it hosted? Is it just the cloud based, or can they host it on their own computers or their own servers? Talk a little bit about that. And by the way, thank you for the demo. And if you're watching live, please let us know in the comments if you have questions, and we're going to continue with the conversation. Jonathan, what's your thoughts?
Yeah, great question. And I think that it's, with cloud computing taking over, it's definitely on top of a lot of people's minds. So this can operate both in the cloud as well as on hosted server. The cloud version for a lot of people is easier these days with the different ways that you would access that. But there are certain circumstances where policy of a company would want it on their own server, and we can facilitate that as well.
So as we think about security from that perspective, while we're on the topic, that they're personally identifiable is protected. I think I just lost everybody there.
I think the question was about how to protect
we're back.
personally
We
identified
dropped there for a
data.
moment. Yeah.
Yeah. So
Yeah, personal data. Yeah, correct. Yes.
good question. You know, being in the healthcare space and doing that, you know, there is always that constant vigilance on PI, PHI compliance. So really for Traksio is we say no personal identifiable data or confidential state, federal controlled data is permitted inside of Traksio. But, you know, as we've seen through the demo, that data is not specifically needed to be effective. So, you know, you can take out personally identifiable data and still get a very, you know, spot on analytics of what you're looking at. So, so we kind of did that balance there, but, you know, for the protection of everyone and not, you know, not having to be a cybersecurity expert when you're trying to set up users and access, we've put it towards that direction.
I would add one thing that when we've had people who use patient data, they just code it, you know, patient ABC, they can go back and see who it is, but they don't put it in Traksio.
Yeah, they remove all
the
that makes sense.
The good thing about that too is, you know, there are a lot of options on there to export charts, to export files, and then that way, if you're making sure you're not using that personal identifiable data in there, you are confident when you are sharing it out that you're not going to lose control. You can still share the success that you found, but not have to lose control of that security.
One of the things I wanted to ask the panel is when you've gone into organizations, anytime you're working with an organization, there's a level of expertise in computer skills that varies from one employee to the other, one team member to another. What has been your experience around how quickly people learn to use the platform?
Well, I can say from my personal experience, I am not an expert in any of this, and I've learned a lot over this process. But now I use Traksio as part of any implementation I do for consulting. And really, you know, I was able to pick it up very quickly and start running through processes. And the people that I'm bringing in that are using it with me at their sites, they usually just come with a couple questions. They're already off to the races on it. So I think what we really wanted to do was there's a lot of software systems out there that you really have to go through a lot of training. You have to go through a lot of you have to have subject matter experts, and you have to have technology on the phone to get everything going. And we really wanted to figure out how we could just make this a very targeted, simplified, to the point, built by users for users type environment. So that way you can effectively get things done during a busy schedule and not have to, you know, worry about, okay, I'm the only one that can do this because I went through the 19 hours of training. And the goal is, you know, with risk and quality, that it's a responsibility of every employee in the organization. No matter who you are, you have impact on that. And so the easier we could make it so that everyone could participate, I think that helps build that culture of risk and safety and quality. So that's kind of where the genesis of where we kind of took the software back to, since, you know, this is building on top of a previous idea, and kind of built it from that point going forward.
Yeah, see, I think to me that's a huge differentiator when you're talking about rural and community hospitals, particularly. I mean, obviously any level of healthcare organizations could use the platform, but I think if you think about in the smaller organizations where people are having to wear a whole lot of different hats, and they're already burdened with having to understand Meditech or Epic or whatever ERP they're using, or Cerner. Like I've got a client right now that's going through a major Cerner upgrade that's got everybody concerned. This seems to be what I love, the simplicity around this from a decision-making support perspective. Jane, I want to jump to this question, and I think it kind of ties into how simple but also effective the platform is. How does Traksio like prepare and track quality measures? How this, I know you went over it in the demo a little bit, but talk a little bit more about how the platform is really a great tool for in the quality space. I would love to hear more about that.
Well, many people have dashboards and they try to do control charts because control charts tell me if something's changing, gives me a signal very quickly. Well, go out there and try to find something that is reasonable, first of all, that does it. And it's usually only targeted to that. And then you have to find out really if they actually have the calculations correct and all the other things. And then you have to do all the formulas, or it's an add-in into Excel. And, a lot of the IT groups don't like this. So this is not an add-in. The getting rid of the formulas. So you've got the, if I had UTIs and for certain types of things, and it's very low, I can use a T chart or a G chart. So I can use the rare event types of charts. For COVID and infectious diseases, we use the exponential chart in one organization to anticipate when the infections are getting worse, and how to manage that. So each tab becomes one of the different measures, and then you can just export it into a report. Or we had management that actually would go into the cloud-based or into the application, and they showed it during their meetings. So it's already updated, and they just click through the tabs and they draw the things, and they have the conversations. Everything's annotated. You don't have to re-annotate because you've updated it. You can phase it when I've got an improvement or it's gotten worse, and we've got to see where it's going to go. So it makes it so easy to use.
I would just add, the other thing that makes it really easy is as your measures change, or you have a situation where you're a bigger healthcare facility that has different departments, and that there may be differing quality measures that you are keeping track of, but all of a sudden, maybe through a survey for accreditation or whatever reason, you identify that there's something that we want to keep closer track on. You can just upload that, import it into Traksio, so you don't have to really spend a lot of time building the data sheet in Traksio and adding data by hand. And so you can then follow that as well.
That leads to another question, Julie, for you. I think I love the idea that this platform is so customizable and can be used for a lot of different uses, a lot of different decision-making uses, quality management, risk management, all those things we talked about. What's an example of, some non-standard uses of Traksio? Maybe that's a question for Jonathan, but maybe that's for Jonathan and Julie. Can you give me some examples about custom tracking and have you customize it as well? But what are some like non-standard uses? I guess that's the first question for you, Jonathan. And then Julie, I'd love to hear you to talk about kind of maybe what the custom tracking features look like.
Mm-hmm. Yeah, I think that for me, what I really go on for first is the meetings. I think that a lot of times not everyone, but some people struggle with meetings, especially if you have to make agendas, keep track of notes, assign tasks out, follow up with people. Somebody's putting a lot of work in to make sure that meeting happens. And so for me, I've had groups that have their board of directors meetings through that. I've had my implementation meetings through that, and it's really become something I lean on, because I was always historically bad at agendas, but I have notes of things that I want to ask in the meeting. So now I can go on Traksio and put those notes in, and then at the end the agenda is done. And then they also the ticketing piece, the corrective action ticketing, that has a lot of uses that we probably have interacted with, IT tickets and some of these things. This kind of brings that ticketing into where we can make any kind of ticket. So whether it's trying to have a place where staff can log patient complaints, or maybe it's just a general feedback. And so those are some areas where that's kind of came in handy. That wasn't kind of the initial intention, but actually turned out to be very effective in keeping track of all that, kind of communicating. And then I'm venturing into custom tracking, but I would rather have Julie answer that, because
Julie, could you talk a little bit about that? Yeah, thank you. That's great. And by the way, I want to come back to the agenda thing in a moment. I love that idea, the use of it. Julie.
Custom tracking, we had a lot of fun with it. It was kind of hard because when we first did it, we were trying to think of different tracking that we have all done, and how to standardize it for people. And then we realized, what we should really do is make it so that people can do it however they need to do it, and whether it's whatever it is. So we sort of took an approach that if you want to track it, and you can identify whatever headers you need or columns you need, whatever your format is, and have the data that you want to be tracked, you should be able to do it. And that's really how we set up custom tracking. So we do have templates for some stuff that are fairly standard. There's, I think, 10 to 15 custom tracking templates. From everything from audit to contracts, and some training. But if you can think about what it is that you want to track, you can put it into custom tracking. And I think the other thing is that you can, you can link custom tracking to other things that you're doing in risk management, project management, and quality management. If there's things that come up that you want to track from there, from a quality management, you can use it for quality control or quality assurance and compliance. If there's different things that you want to track that can lead you into identifying areas of risk. So that there's just a lot of different ways that you can use it. And I think in general, we did the same thing across Traksio. So like Jonathan mentioned, the corrective action can be used for a lot of things. I think for things like patient complaints, you can just go use that, put in your patient complaint, and then follow up on have things been taken care of, and then have that report generated. So, we try to keep that the same throughout Traksio, just like you can use FMEAs and RCAs attached to risk assessment or enterprise risk management assessments, or do them separately depending on what's happening in your organization. We really wanted to take an approach that the Traksio doesn't drive what you do, but it can do anything that you need it to do in the area of risk, project, and quality management.
Let me interject for a minute, because I remember one of our conversations. We were talking about that.
Jane? Yep.
Yeah. So Jonathan was talking about, he used to help manage SharePoint. And with SharePoint, he had to organize who could get in, who couldn't get in. And people would have different documents, and you can just upload that into the custom tracking, and then you can set the access to it just really quickly. And it's, Jonathan, you can talk on that, comparing that with SharePoint versus using the Traksio access button.
Yeah, I think the one thing that we tried to do, if you look at all these pieces, you might be saying, well, we have Excel and we have SharePoint, we have this project, you have all these different softwares doing, and a lot of people use like 2% of the software. We have these large, expensive softwares. We don't, if you're really good at it, you can get really deep in it, but most people are at the user level. And so what we wanted to do is kind of pull some of these in and say, okay, what does the most users of SharePoint not know how to do? And that's secure their or the Cloud 360 now, but is to keep that, like, who's seeing this? How do I know? I don't know.
Yeah.
Same thing with like the flow diagrams. We try to make that as simple as possible. Is it going to be a record-breaking flow diagram that has all the bells and whistles? No, but it's what we as users will most likely use. And so, as we look at all those different pieces, besides the analytical tools, it's really bringing in the best of all those pieces, putting it together, and having kind of one source of truth that we don't have to chase around everything. So if we want to track something that has to do with this, we can all do it in one spot. If we want to put a file in there for a group of people, we can do it in one spot. If someone wants to know, where do I submit this corrective action ticket, it's always going to be in, head to this one place, and we can, it's like our fancy playground. We can do whatever we want in there. And it's really got the stuff that we need without all the stuff that we don't need. And I think that's kind of like, it could have gotten really huge and complicated, but we always try to say, okay, let's look at this again and bring it back down and figure out where we're at. And I think that's kind of what I love the most about this is that simplicity.
It's a great place now to jump right to the meat of this thing. So talk about if an organization is interested, pricing model look like, what's the implementation process look like? How do you support it? So I guess there's 3 questions in there. Can you talk
Sure.
a little bit about, and I love all your input on how to get people started. What's the pricing model look like? How's that follow up?
Sure.
Do that.
So we've
Jonathan,
got,
can you speak to the pricing model? Yeah.
Okay. So we've got, different pricing for whether it's cloud-based or server-based. And we do yearly pricing. With most things, the longer you agree to sign up for, the better the pricing is. We have kind of changed the model a little bit from how other people do it. A lot of people right now are doing per user, per month billing. And so, it looks like it's going to be $20 when you start. And by the end of it, you've got 1,000 users at $20 a month. It starts to add up. So we took it more to a yearly piece. And we do it by site. So each site can have unlimited users and admin. So if you're, the hospital and you have 200 people that you want using it, then it's under that site. And it's very quick. The setup's very quick. We can get people online within a matter of a week or so. And so that's there. The trainings, there's a lot of trainings that we put together already. So usually I can get everywhere I need with the training that Julie and Jane have put together. But we also offer support in addition to that if need be, or consultative support if need to have help kind of getting off the ground, learning how to run kind of risk and quality programs, things like that. And then we also have, if you're a larger organization that has multiple sites, then we can do custom pricing based on user sites, things like that. And then we also have a kind of a special pricing model for education institutions as well.
Mhm.
So where there may be students having to get access, that, and then the education entity. So we're kind of in between there. So it kind of just depends on where you fit. Luckily, you only have to deal with me. So I have, I will get in and talk about it. I think that, we're really looking at, depending on who we're supporting, there may be opportunities for rural healthcare clinics that may be, grant funded and really having trouble to do, maybe having some co-ops between some other rural health centers and things like that. So really it's, we're out there to get this out and get it in people's hands so we can make a difference, and we'll figure that out with them.
That's a great way to wrap it up. Any last comments, Jane or Julie, on how easy it is to get Traksio up and going, and what their next steps would be?
Well, I'd make one comment. If you do any project management, you try to build a Gantt chart. Julie and I tried to do it, and it was like 53 steps, and we said, no, Traksio can't do that. We got to simplify this thing. And I was talking to somebody who does project management. They said, oh, no, not 53 steps. It's more like 78. And
Wow.
oh my gosh, you have 2 steps. So, everything we did was make it easy to do the right thing. And because of that, it makes it easy and fast to get people on board. The ribbons are there. They're all standardized. The lists are all standardized. Everything is standardized. The location is. And then in the improvement science, standardization and simplification is one of the best ways to improve things. And we built that in. So as Jonathan said, he got on board. He's probably asked 4 or 5 questions of Julie and I, and that's it. And he's just off and running, and he hadn't come back since the initial, here it is. And he's been working with several clinics and several applications and several partners, and it's not causing issues, which is what we wanted to do, because I really like what Jonathan says. It was built by users for users.
Yeah.
It wasn't built by software gurus who are trying to do things and follow something. We've been doing this for 40 years, and we know how long it takes to get people and ramp them up. You don't have time for that. If you want to get rid of that time, use Traksio. It's integrated. It's all in one place. It's sweet. It's sweet.
What a great way to wrap that up. I always think about tools, all kinds of tools, whatever tools they are. The best tools are the ones that have been developed by the people that use the tools all the time. And so I love that comment about how what you just said, Jane, is like, okay, these are the tools we're using. We're in the trenches. These are the tools we're using. Let's make it work. Julie, any last comments? We'll wrap this webinar up, and we'll make this available online so people can watch the recording, go deeper. We'll make in the comments also, we'll post it on LinkedIn so people can connect with you, Jonathan, if they'd like to get a demo and go deeper. Julie, last comments from you, and then we'll wrap up.
I think my last comment is we really tried to make Traksio work for everybody, not just the subject matter experts. So it helps you as an organization to build capacity. So whether you're doing project management, risk management, or quality management, doing improvement projects, you don't have to be an expert. You have to just be able to follow these steps. And, it also supports those in the organization who are the experts to be able to have a tool that others in the organization that are at the where the rubber meets the road, if you will, at the point of contact, that they're able to help those experts, which in most organizations there's few in these areas. So I think being that force, helping to be that force multiplier is really important.
A great way to wrap it up. Thank you all for being here on the our first Healthcare Thought Leadership formerly LinkedIn Live show, which we have, but also our webinar series. Today we're featuring Traksio. If drop a note in the comments or send us a message on LinkedIn, we'll get you connected with Jonathan, Julie, and Jane. And we're glad to have you. Happy Friday. Have a great day. And we'll end right now. And we appreciate you all being here. Thank you very much.
Thank you.
Thank you.